I gradually noticed that going downhill was becoming really painful.
And then when you were playing tennis, it used to just swell up?
Swell up very much. Sleeping was a problem because once it was aggravated, you couldn't really get a comfortable position in bed. Of course, it keeps you awake then. I did take pain relief, anti-inflammatories, which do give you a little bit of...
You're also scared of it giving way on you, weren't you?
Yeah.
Coming downstairs.
Yes, that was the other thing, yes.
An individual like Richard, who is young, he was looking forward to spending, his retired years enjoying an excellent quality of life. His wife happens to be a physiotherapist as well, so they were both on board with a procedure that would enable him to have less pain, less swelling, and have as quick a recovery back to normal function as possible. And that's when I discussed the option of MAKO, robotic arm-assisted surgery, with Richard.
I contacted Mr. Mahmud
privately,
yeah. And I saw him within about 3 or 4 weeks, wasn't it? Yes, very, very quickly.
So we just thought, do we want to live a bit of a life now or wait and get more and more depressed? So we went for it.
This is one time where I think you can actually buy health. Not always, but with it.
So we're lucky.
Yes, lucky.
Being able to use MAKO, we were able to resect the minimal amount of bone in order to get the implants in just in the right place and to balance the ligaments on the inner side of his knee to make that knee feel as normal as it could. We were very fortunate to be able to plan and perform a partial knee replacement, which is more bone conserving and is less invasive as well. And I do remember very clearly the moment Richard stood up on his knee for the very first time, he told me his knee felt normal, and that was within the first day. So for an individual like Richard, I think that MAKO technology was ideal, and I think it was a perfect match for him.
From driving into the car park, I felt very, very happy there. The reception was good.
Your room was nice.
The room was lovely. I felt happy and calm and not stressed. It was fantastic, really.
When you walk into the Alexandria Hospital, you get confidence from the moment you walk in. And I do too, as a consultant working here, and I choose to work here because I know my patients will be given the best possible care and treatment, and that's why I choose to practice here.
I was amazed, having seen knee operations many times before, how quickly he got a range of movement back.
Before I had the operation, I could hardly walk downhill. I think on about the 3rd or 4th day we went to walk at the road. I managed to do about a quarter of a mile, didn't I?
Yeah,
up
we
to the
used to
church.
go up with the 2 elbow crutches and go a bit further each
Keep
time.
expanding at the walk, yeah.
It's really rewarding and really satisfying when you see a patient like Richard, come back having achieved all of those things. And, making a big impact on people's quality of lives really is what drives me, and it's really why I'm here.
I would definitely recommend it highly, yes, because it's proved it with myself. I was never apprehensive about it at all. I'd got complete trust in him.